my dear students. Good morning. Today we learn the new topic leukemia. But first I introduce myself. Myself Miss Sapna Rajput, and today we learn about the leukemia. So leukemia is a very important condition. So now today we learn first of all definition. Leukemia is defined as a cancer of the body's blood forming tissues including the bone marrow and the lymphatic system. So leukemia otherwise we known as a blood cancer, and it is a very dangerous condition including the bone marrow and lymphatic systems. Many types of leukemia exist. Some form of leukemia are most common in children. Other form of leukemia occur mostly in the adults. That means leukemia is agar any age of group like children or adults. So in some types of common leukemia occur in children and other form of leukemia occur mostly in the adults. Next we learn the causes. In that a scientist don't understand the exact cause of leukemia. It's seen to develop form of combination of genetic and environmental factors. So how leukemia forms? Certain abnormalities causes the cell to grow and divide more rapidly and to continue living when a normal cell would die. Over time, this abnormal cell can crowd out healthy blood cell in the bone marrow, leading favor healthy white blood cells, red blood cells, and platelet, causing the sign and symptoms of leukemia. So many scientists study about that, but exact cause of leukemia that not understand. To develop form of combination of genetic and environmental factor. So ideally, we can say the combination of genetic and environmental factors are responsible for the leukemia. And how leukemia forms, so certain abnormalities causes the cell to grow and divide more rapidly and to continue living when a normal cell would die. Over time, this abnormal cell can crowd out a healthy blood cell in the bone marrow, leading to favor healthy white blood cells like red blood cells, white blood cells, platelets, and all things. And then after causing, sign and symptoms will be developed about the leukemia. Then next we learn the risk factors. So which are the risk factors are responsible for the leukemia? In that, factors that may increase the risk of developing some type of leukemia include a previous cancer treatment, genetic disorder, exposure to certain chemicals, smoking, and family history of leukemia. So in that previous cancer treatment, that means those who are suffering under the cancer and they take up treatment of the previous times, so that people have also risk factor of the leukemia. Then genetic disorder, those people who having the genetic disorders, then like a congenital disorder and exposure to certain chemicals, those people who are working at that occupational area and exposure with that type of certain hazardous chemicals, smoking, and family history of leukemia, those people who having already a history of leukemia. So these all are the risk factors responsible for the leukemia. Then next we discuss the classification. In that, doctor classify leukemia based on its type, speed of the progression, and the types of cell involved. So classify according to leukemia based on spread of the progression and the type of cell involved. In that the first type of classification is by how fast the leukemia progress in the acute leukemia and chronic leukemia. So in acute leukemia, the abnormal blood cells are immature blood cells. We can see the blast. They can't carry out their normal functions and they multiply rapidly, so the disease was quickly. Acute leukemia requires aggressive timely to treatment. And the next, chronic leukemia. There are many types of chronic leukemia. Some produce to many cells and some causes to few cells be produced. Chronic leukemia involves more mature blood cells. That blood cells replicate to accumulate more slowly and can function normally for the period of time. Some form of chronic leukemia initially produce no early symptoms and can go on unnoticed to undiagnosed for years. So in that, mainly two types is here, acute leukemia and chronic leukemia. Acute leukemia, abnormal blood cells are immature blood cells, we can say the otherwise the blast. And chronic leukemia, there are many types of chronic leukemia. Some produce to many cells, some causes to few cells, and some be reduced. So chronic leukemia involves more mature blood cells. The next one, the second type of classification is by type of the white blood cells affected, lymphocytic leukemia and myelogenous leukemia. So in that lymphocytic leukemia, this type of leukemia affects the lymphoid cells like lymphocytes which form a lymphoid or lymphatic tissues. Lymphatic tissues make up your immune system. And second one is myelogenous leukemia. The type of leukemia affect the myeloid cells. Myeloid cells give rise to red blood cell, white blood cells, and platelet producing cell. So in these two type, acute and chronic, lymphatic leukemia and myelogenous leukemia. This type of leukemia affects the lymphatic cell. Lymphocytic leukemia in that affected the lymphocytes, and in that myelogenous leukemia affected cells are myeloid cell. The next one, major type of leukemia. In that major type of leukemia is present here. First one, acute lymphatic leukemia. Second one, acute myelogenous leukemia. Third one, chronic lymphatic leukemia. Fourth one, chronic myelogenous leukemia. And fifth one, other types. So in that first one, acute lymphatic leukemia, lymphocytic leukemia, in that this is the most common type of leukemia in young children, all can also occur in adults. Then acute myelogenous leukemia is a common type of leukemia. It occurs in children and adults, and acute myelogenous leukemia is the most common type of acute leukemia in the adults. Then third one is a chronic lymphocytic leukemia is with chronic lymphocytic leukemia, the most common chronic adult leukemia. You may feel well for years without needing a treatment. Then chronic myelogenous leukemia, this type of leukemia mainly affect the adults. A person with chronic myelogenous leukemia may have a few or no symptoms for a month or years before entering a phase in which the leukemia cell grow more quickly. And fifth one, other types. In that, other rarer types of leukemia exist, including hairless cell leukemia, myelodysplastic syndromes, and myeloproliferative disorder. So in that other types, here two things is most important: myelodysplastic syndrome and myeloproliferative disorder. Both these types of including in the other types of leukemia. And first, fourth one, there are a common lymphocytic and myelogenous. In that two phase, acute and chronic. So acute lymphocytic leukemia and acute myelogenous leukemia, chronic lymphocytic leukemia and chronic myelogenous leukemia. The next one, we discuss the symptoms of leukemia. So leukemia symptoms are vary depending on the type of leukemia, like a chronic or acute, lymphocytics or myelogenous, otherwise other type of that. So common leukemia signs and symptoms include fever or chill, persistence, fatigue and weakness, then frequent or severe infection, losing weight without trying, swollen lymph nodes, enlarged liver and spleen, easy bleeding or brushing, recurrent nose bleedings, then tiny red spots in your skin, then excessive sweating especially at night, and bone pain or tenderness. So these all are the common symptoms under the leukemia, like fever and chills. There are a very common persistence, fatigue and weakness, that is other common things. Frequent or severe infection because of our immune system are affected, and our red cell, white blood cell and platelet are also affected under the leukemia. Then losing weight without trying, then continuous weight losing, then swollen lymph node, enlarged liver or spleen, easy bleeding or brushing, then recurrent nosebleeds. Nosebleed is very common under the leukemia. Then tiny red spot, excessive sweating and bone pain or tenderness. The next one, we discuss the diagnostic test for the leukemia. So in that first one, doctors may find a chronic leukemia in a routine blood test before the symptoms begin. If this happens of it, the patient have sign or symptoms that suggest leukemia, patient may undergo the following diagnostic diagnostic exams like a physical examination, blood test, and bone marrow test. So, in that first one, physical examination, physical sign of leukemia such as a pale skin from anemia, swelling of lymph nodes, and enlargement of liver and spleen. So these all things we identified under the physical examination because we performed the head-to-toe assessment completely in the physical examination. So we can able to easily identify the swallow lymph nodes or enlargement of liver or spleen, then color of skin and any other infection present on the skin. Second one is a blood test. By looking at the sample of blood, doctor can be determined if the patient have a abnormal level of white blood cell or platelets which may suggest a leukemia. So blood test is a very important test under the leukemia because after the blood test we can exactly identify what is the condition in that patient. And last one, bone marrow test. Bone marrow test is a very important in this also because leukemia is under the leukemia condition our affect our red cell, blood cell, and bone marrow and platelets. So bone marrow test is very necessary. And last one, if we can discuss the management. So management for the leukemia in that treatment and drugs. Treatment for leukemia depends on many factors. Doctor determines the leukemia treatment options based on age and overall health. That is a very obvious things. Obviously, treatment of leukemia, not only the leukemia, other treatment of other condition that also depends on a treatment based on age and overall health of the patient, the types of leukemia and whatever it has spread to the other parts of the body. So treatment is depend on these all things, and common treatment used to the fight leukemia include chemotherapy. Chemotherapy is the major form of the treatment leukemia. This drug treatment uses the chemical to kill the leukemia cells. So chemotherapy is a very common treatment for the cancer and under the leukemia that kill the cell of the leukemia. Then depending on the types of leukemia, patient may receive a single drug or a combination of drug. This drug may come in the pill form or they may inject it directly into a vein. So under the chemotherapy drug, whatever drug is present, that form is pill and they inject it directly into the vein because directly if we provide the IV route, so that is the most affected, very quickly affect in our body. Then biological therapy. In that biological therapy work by using a treatment that help your immune system recognize and attack the leukemia cell. Second one, radiation therapy. Radiation therapy is same like a chemotherapy. I mean it's very common in the cancer. Radiation therapy is also very necessary. So radiation therapy uses a X-ray or the other high energy beams to damage leukemia cells and stop their growth. During the radiation therapy, patient lie on a table while a large machine moves around the body and detecting a radiation and directing a radiation to So radiation therapy is also very important in that X-ray or beam of another energetic beams provide in our body, and our body lie on the one table and machines provide that rays on exactly on our body, and that rays kill the affected cells. The next one, patient may receive a radiation in one specific area of the body where there is a collection of leukemia cells. Radiation therapy may be used to prepare for the stem cell transplant. So patient may receive the radiation is one or specific area that body whatever there is collection of leukemia, that means collection of infected cell and stem cell transplant. It is a prepare for stem cell transplant. And next one, stem cell transplant. A stem cell transplant is a procedure to replace a diseased bone marrow with the healthy bone marrow. The next one, before a stem cell transplant, patient receive a high doses of chemotherapy or radiation therapy to destroy diseased bone marrow that receive an infusion to blood forming stem cell that help to a rebuild the bone marrow, and patient may receive stem cell from donor or in some cases patient may be a able to use on stem cell. So these all are the management present for the cancer patient, or specifically we discussed today leukemia. So these all are the management provided to the leukemia patient: chemotherapy, biological therapy, radiation therapy, stem cell transplant, and last one, patient may receive a cell from donor. The next one, we discuss the nursing diagnosis. In that, risk for infection related to inadequate defense mechanism, actively intolerance related to inadequate oxygen of the blood, then altered nutrition less than body requirements related to inadequate nutritional intake and anorexia, then ineffective self health management related to a lack of medication regimen. Ineffective self-health management related to a lack of knowledge about the appropriate nutrition and medication regimen. So these are all are the nursing diagnosis for the leukemia. Then intervention, in that encourage the patient to discuss quality of life issues, then closely monitor temperature, observe for a fever associated with the tachycardia and hypotension, etc. Inspect the skin for the tender erythematous areas and open wounds, clean skin with the antibacterial solutions, change IV tubing according to a facility's policy, use strict sterile technique, and if the patient receive a total parenteral nutrition, give a catheter care, monitor laboratory test for the signs and symptoms of infection, develop a plan of care to help a patient manage the severe side effects of the chemotherapy, then provide a knowledge about all drugs being administered and their side effects, encourage alternate rest and actively periods to provide activity without train the patient, then monitor cardiorespiratory response to activity to evaluate activity intolerance, limit the number of visitors and eruption by the visitor to provide a rest period. So this all things is including under the interventions. In that, encourage to patient and discuss with him or her quality of life issues, then choose the monitor temperature, observe all the vital signs, then inspect the skin tender, a physical examination, observe day-to-day patient which different type of changes occur in day-to-day, then limit number of visitors, interruptions by visitors to provide maximum rest to the patient, encourage to the patient for taking a nutrition, and if patient a parenteral nutrition, total parenteral nutritions, then give a catheter care, then monitor laboratory test for the symptoms of infection, develop plan care for the patient, manage a severe side effect of the chemotherapy, provide knowledge about all the drugs, begin administration and their side effect. The next one, continue, arrange a physical activity to reduce the competition of oxygen supply to vital functions. Example, avoid activity right after meals, then assist with the regular physical activities. Example, ambulation and transfer. Then determine in collaboration with the dietitian number of calories and type of nutrition needed to meet nutritional requirements to plan intervention. Teach patient how to keep a food diary to help evaluate nutritional intake, then monitor recorded intake for nutritional content and calories to the evaluate nutritional status, encourage the increased intake of protein, iron and vitamin C to provide a nutrition needed for the maximum iron absorption and hemoglobin production, then implement measures to prevent issue energy bleeding, injury bleeding, or gentle brushing of the teeth or gums with the soft toothbrush, cotton swabs or sponge tied up applicator, using an electric razor and avoiding sharp razor when shaving, avoid a forceful nose blowing and needle sticks. So this is also intervention included in the management for the nursing diagnosis, related with the nursing diagnosis, to monitor recorded intake for the nutritional content, is that easily we maintain the input and output ratio day to day. Then teach patient how to keep a food diary and help evaluate nutritional intake, then implement measure to prevent this tissue injury or bleeding, gentle brushing or teeth or gums with the soft brushes, cotton swab or sponge tipped. The next one, encourage patient to keep a diary of daily routines and energy levels, noting activities that increase the fatigue, provide a quiet environment and uninterrupted taste, then uninterrupted rest periods, encourage rest period before a meal. That is most important thing. Encourage the interrupted rest periods and before the meals, so that is a very effective, because after meal if rest is more, so then digestive problems occur. Then assist with the ambulation and other activities as indicated. Review with the patient measurement of fluid intake and output, hemoglobin values and blood pressure readings or weight gains and losses. Provide a psychological support by the establishing a trusting relationship to promote a communication. Allow the patient and family to discuss or verbalize their anger and depressions, and let the family participate in the patient care as much as possible, and administer antibiotics and supplements and other symptomatic drug according to doctor orders. So these all things is a very important. Administer antibiotics and supplements and other symptomatic drug according to a doctor prescription and according to a rule of the drug administration, like right dose, right route and right time. Then provide a psychological support. That is most important thing, because under the leukemia or under the any other condition like of cancer, so patient is a very anxious and they feel a very anger, so that time psychological support is the most important. And trusting relationship improve, promote a communication, because that will be a very helpful for the patient and hospital staff or family also. Then assist with the ambulation or other activities as indicated, and encourage patient to keep a diary too of the daily routines and energy levels, noting activities that increase the fatigue, because if we are notice that all things a daily routine in a diary, so we are easily identified or observe that all things how to day to day improve a patient condition, how patient are improve they how our treatment are affected or how our treatment are improving. So this thing is a very important. So now today we learn the leukemia definition, types of leukemia, I mean cause classification. In that classification, acute and chronic, lymphocytic and myelogenous and other types. Then causes, risk factors, sign and symptoms, diagnostic evaluation, management, nursing diagnosis and interventions. And thanks for watching.